right there. All right, and we are on. So go ahead, Andrew.
Thank you, Richard. You say an hour is long enough. I could talk about this topic for days. So I'll try to focus in on what would be important if this is my only chance to communicate to people I haven't met before and who might be future therapists. So the topic has two words in it. One is psychedelic, the other is therapy. So let's talk about therapy first for a minute, because one of the first things that come to mind, especially now with the new renaissance of the use of psychedelics, is to make sure that we are not going off in the wrong direction. The magic is not in the psychedelics. There is magic in psychedelics, but the real magic is in relationship. And therapy is about relationship. My training that I consider training wasn't in university. It was when in 1974, I went over to England and worked for a year with R.D. Laing, the Scottish psychiatrist, who actually called himself an empirical, interpersonal phenomenologist. And he noted that this empirical interpersonal phenomenology is really a branch of social phenomenology. That's where he located himself, which makes me underline that when I think of psychotherapy, which I have practiced for over 50 years, I want to say any medical influence is really troublesome. Any psychological, what we normally call psychology, is troublesome. So psychotherapy, as far as I'm concerned, has nothing to do with psychology, and it has nothing to do with psychiatry. It has nothing to do with medicine. Mental illness is a bad metaphor. We do think and we do talk and we do a lot of things. We communicate through metaphor. And so we have to be very careful, number one, not to forget that often we talk in metaphors, and choose metaphors which are more accurate and take us closer to some kind of reality rather than bad metaphors which take us further away from it. Thomas Sass, over 50 years ago, wrote a book about the myth of mental illness, and nobody wants to hear it. We still talk about mental illness when, you know, we could be talking about unicorns, but there are no unicorns. We talk about mental illness, but as far as I'm concerned, there is no such thing. There are brain diseases, as Sass said, in which case one should consult a neurologist or a brain surgeon, or there are problems in living. And when we are talking about problems in living, most of the discussions, most of my days are spent basically in inquiry that is informed with philosophy, by philosophy, and ethics and politics. Ethics, I say, because it's the science of how to treat each other. And the first treatise on ethics was written by Aristotle, who said it wasn't about how to be good, it was about how to be happy. Because he thought, if we treat each other badly, if I treat others badly, and I allow others to treat me badly, I'm not going to be happy. So eudaimon is the Greek word for happiness, and Aristotle, his whole thesis on ethics is about happiness. Politics, because the greatest cause of unhappiness, I think, is powerlessness. And the science that teaches us how to gain sufficient power to do what I want and not have to do what I don't want is politics. Politics is the art of gaining and maintaining power. So you could call it micropolitics because it's about the individual. So as a therapist, most of my discussions are about ethics and politics. Now, basically, what I learned from apprenticing with Laing was that the aim of therapy wasn't to do with healing. Healing what? Where's the wound? Again, we are into metaphors. Therapy is an opportunity for a person to have an experience with another human being, to have a relationship of the sort that they never had before. So basically, the aim of therapy is to have an experience that is novel, a transforming experience through relationship between two human beings. One of the things which I think Laing is should be famous for is his living that there is no us and them. There is only us. And so there are no therapists, there are no patients, there are only us. Whatever happens in a therapy hour happens between two human beings, and the worst has already happened to the therapist as well. So the therapist himself or herself is in the same boat with the patient, except perhaps has more experience in the inquiry of what to do when one doesn't know what to do. Mostly people come into therapy because they are perplexed, not because they are sick. So the tradition that I found myself in is a skeptical tradition. Among the ancient Greeks, the skeptics were the therapists, and their patients usually were the dogmatics. People who had dogmas suffered. The primary question of the skeptics was, are you sure? That was the healing question. I find myself asking that question very often of myself as well as the people who come to see me. One of my first conversations with Laing when I arrived in England had to do with our experience with psychedelics. I told him some of my experiences under LSD. He told me some of his experiences under LSD. And then he paused and he said, all right, so I believe you. I'm sure you believe me. We talked about our experiences. The big question is, what do they mean? What does it mean? What does it mean that you experienced A or B or C? And very quickly, we arrived at the conclusion that I don't think in this human lifetime, any of us will ever know what any of it means. And I think it's very important to keep an open mind, and this is where phenomenology comes in. Phenomenology is not interested in explanations. Phenomenology is not interested in whys. It's basically interested in accurate descriptions and depictions. What is the case? What is your experience? What is going on? And try to find the right words to describe something accurately. The experience which I have been having now for years and that keeps me working even now when I'm in really my 84th year, is that as one comes up with a formulation, almost poetic, finding the words for what is going on, something shifts. It's like veil upon veil shall lift, and veil upon veil shall remain. I don't think we can ever arrive at what is the grace. Reality seems to be so complex that any description in language is like a poor map of a very complex territory. So one of the things that I got supervision for from Laing was psychedelic therapy. Now, how Laing defined it and practiced it is that it's really an experience that the therapist and the patient go into together. I have a philosopher friend, his name is Alfonso Lingus, who doesn't have much respect for therapists in general. But in conversation with me, he spoke admiringly about a Brazilian psychotherapist who proposed to one of his patients to climb one of the highest mountains in Brazil together. He himself, the therapist, tried it before unsuccessfully, never got to the top. And he said, what do you think? Do you want to, we'll prepare, we'll do it, and then we'll talk about it, how it was. It may take, a few months for this venture to unfold. Are you up for it? Now, this is where psychologists very much like informed consent. Now, can you imagine to get informed consent about such a venture? Which, by the way, foreshadows what I would say about getting informed consent for a psychedelic therapy session. There is no such thing. You don't know what you're consenting to. It's impossible to know what you are saying yes to. I also noticed in my own life that the most important decisions I have made ever since I was 16 were all of that sort. I said yes to certain possibilities that I had not the faintest idea what I was saying yes to. So this Brazilian therapist and his patient went on this mountain climbing expedition. They were 3/4 way up. The weather turned very bad. They had a hard time. Difficult climb. They decided to stop, go back to base camp, and call it a day, went home. Both of them said it was a significant experience in their lives. I think this kind of, so for example, a Sherpa, this therapist acted as a Sherpa because he had more experience climbing mountains. That's really the expertise I think a therapist can possibly have, is that he or she has years of experience inquiring into people's experience and relationships and or effect on each other. Like the poet E.E. Cummings says, I am, through you, so I. Now, going back to my first session as an therapist, as an LSD therapist, my patient was a young man, and he, I think, took 500 micrograms of LSD. And here is another point that is very controversial or hardly even spoken of today in this Renaissance. I took 250. Lang's practice was that the therapist took half as much as the patient. Otherwise, how could there be genuine communion? It would be like, let's go climb a mountain. You climb it, I'll watch you from with binoculars, or I'll watch you through television. Not the same experience. So halfway through the session, the young man smiled at me and said he would like to have my penis up his ass. Would that be possible? I said, a very interesting request. We are not going to do it, but we can talk about. We'll inquire where that desire would come from. It was a surprise to me. Like, like obviously, when one goes on a journey like this, whether it's mountain climbing or doing LSD with someone, you don't know what the next moment will manifest. It's full of surprises. I remember next day going for supervision and telling Lang about this request of my patient. Lang agreed that I did the right thing, saying we are not going to do it, but we can talk about it. He himself thought that this young man experienced a high degree of elation and excitement in his connection with me. And in his previous experiences, the only comparable experience he may have had was a sexual experience. So Lang figured he sexualized the excitement of being together when it really essentially wasn't sexual. But that's the only compartment that made any sense to my patient. Stanislav Grof, much later, when I witnessed him doing LSD therapy, he certainly didn't take any himself, and he kept his distance and didn't much interact with the people that he was attending to. He told them to get into a sleeping bag, put on eye shades, and put on earphones that they were given pre-programmed music through. Totally different conception from Lang's. When Lang did an LSD session with me, he basically was absolutely open to allow me to go in and basically just provide a safe container with no interaction. But if I wanted to interact with him, if I addressed him, he was right there, and we could converse or be silent. He was ready for pretty well anything that I wanted to do. The difference was that he was the container, I was the contained. He was the lover, I was the beloved. He was the parent, I was the child. He provided a play space, as Winnicott would talk about the therapy space, where I could explore my desires without his desire interfering, without his desire dominating the situation. I think basically that's the major contribution a therapist can make to a patient's life, is to provide a space uncontaminated by his or her own desire, where the patient feels safe to play with, to explore, to put words to desires that have been whispered or were whispers in comparison to the loud demands that family, society, other people made. The crucial moment in all psychedelic therapy, I think, is, and the only way I can demonstrate it is, it looks like here, two people are separate. But LSD and most of the psychedelics or entheogens allow people to go to where we seem to be one, where there is no separation. Now, that's a topic that we could talk about for a long time. I think there is some kind of connection between pain and separation. If you have pain, it isolates you from other people who seemingly don't have any pain, because you are taken up with your pain and you have very little energy to connect, and you have all sorts of feelings about people who don't have the pain that you are, that's a constant companion to you. On the other hand, separation hurts. Somehow, one of the first experiments with LSD was carried on by Timothy Leary himself. He went to a ward of terminal cancer patients and gave a fairly large dose of LSD to, let's say, a dozen of them. I'm not certain of the number, but it was in the neighborhood of a dozen. Some of those, most of them had a unitive experience, an experience where it feels like your ego dissolves and you begin to see not only that you are one with another person, but you are one with all human beings. Not only that, but that you are one with the universe. So that's what I would call a religious experience, because the essence of it is realizing that you are a small part of something larger than yourself. Now, those cancer patients who had this unitive experience, after their trip, never took any painkillers. In comparison to how much painkillers they self-administered before, it went down to 0 until they died. The ones who, for some reason, escaped or avoided, or simply didn't happen, this unitive experience, they continued medicating themselves with painkillers at the same level as before. There are many other similar experiments showing how the subjective feeling of connectedness diminishes the subjective experience of pain. So the present emphasis seems to be how to how to train psychedelic therapists in such a way that it will be acceptable to the powers that be. Now, this MAPS is the organization that has done most in politically to make sure that sooner or later psychedelics will be taken off the prohibited list of drugs and will be used as will be widely available to for use. In order to do that, however, they had to, I would say, pretend that they are doing scientific studies. I was involved in one of the first MDMA studies, certainly the first in Canada in 50 years, where Health Canada gave permission to do a double-blind study of doing psychotherapy with traumatized people who were diagnosed with PTSD, with placebo or with MDMA. And in order to compare it to other studies done in the States, Mexico, Europe, there had to be a protocol of how we were going to do the therapy. Well, I don't want to spend too much time on it, but to even think of having a protocol, not just in psychotherapy, but especially in therapy that is happening in an altered state of consciousness, it's absolutely amazing. Anybody could think that there could there be possibly a protocol. What nobody in the present discussion talks about is that in that particular altered state that most psychedelics take you, when you look at the other person, when you look at the other, there's only one question that's really important. And it usually comes out very simple. You look into the other's eye and you say, do you really care? Do you really care about me? That's the only question that matters. Now, how could there be a protocol about this? Like, what is the therapist supposed to say when the patient looks into the therapist's eyes and asks that? Because actually, if there is any falseness, if there is any bad faith, if there is any pretense in this altered state, it can drive the participants crazy. So it's better to say, no, I don't think I care. I just do this for the money. That would be better than to lie. Because when the meeting is down here, or at least one, say the patient is down here, then the patient knows if the therapist lies. So when for my graduate work, I did a study in mutual hypnosis. The idea was, because psychedelics weren't legal at all, the idea was that two people, volunteers, would hypnotize each other. A would hypnotize B as deep as B could go, and then leave a post-hypnotic suggestion that B should hypnotize A as deep as A could go. And they would go back and forth, A hypnotizing B, B hypnotizing A, all the way until they were both in a deep trance. Now, at that point, there was a tape recorder there, and they were given half an hour, basically, to have an experience together in that state. The tape recorder showed that there was no verbal exchange between them. There was silence. At that point, we separated them when they went into separate rooms, and they had to write down what they experienced during that half hour when nobody spoke. And what they wrote down were identical experiences. They were on the same beach, they went out in the same boat, they had the same conversation. They had one experience in that state. Now, if that state, and then when they came out, the reason why I couldn't do it with too many people is because the volunteers were so shocked at the depth of intimacy that they came out of that experience with, that in a way they could almost not look at each other. They said it was more intimate than a sexual experience. And they weren't prepared for it. Now, I think that the possibility with psychedelics and therapy is to reach that level of intimacy, togetherness, and oneness. Now, that can be very healing, but of course, it's like even the memory of that oneness. For example, often in a wide variety of psychedelics, not just LSD. I'm mainly talking about LSD because that's what I have most experience with. There is a point where one can go into a sequence of what we could call ego death, where you cease to exist. The subjective experience is basically that you think that you overdosed, you're dying. And then there is no experience, there is nothing. And then out of the nothing, there is a very peculiar experience of trickling back into yourself. You can only say reborn. Now that experience, which is really a crucifixion and the resurrection part, people who have gone through the resurrection part find themselves in a far more relaxed state than ever before. The words that I would put to it, from my experience, is I realize that I don't live by my own wits, that survival or wanting to survive, any kind of striving, is mistaken. It's a clear experience of I am being lived. I don't know by whom. I'm not religious in any way except these experiences. One could say life. Let's say life lives me. I don't know how to liver my liver. I don't know how to kidney my kidney. I don't know how to beat my heart. I didn't put myself together in my mother's womb. Something lives me. Now, if there's something, if I can't trust whatever lives me, I can't trust anything. So psychedelic therapy deepens one's trust in the universe. My mother and father may not have been perfect representatives of the universe, but through psychedelic therapy, you can wake up to the possibility that you're not your parents' children. You're not your parents' child. You're a child of the universe. It's like the apple tree apples, the universe peoples. We are the fruits of the universe. And the branch on which I grew may be to do with my mother and father, but the life that lives me has nothing to do with them. The depth of that, you know, as I say it now, what can it be except a neocortical experience? But under LSD, your reptilian brain, your horse brain, and your neocortex are unified into one experience. And so at the end of it, of course, as I said earlier, I can't be 100% sure that that is a reality. But as far as metaphors are concerned, that we are using to understand what we are doing here on Earth, it's not a bad metaphor. So I'll leave it here. I'm sure that you have some comments or questions. We have about 15 minutes to deal with them.
All right, if we could try to raise our hand, that would be best. I think you can do that under reactions or something. Do we have a question? All right, Andrew, go ahead. Andrew Scott.
Okay. Yeah. Okay. Yeah. Thank you so much for this, Andrew Feldmar. It's an honor to get to hear you speak. So I have a question about your perspective on psychedelic assisted therapy. So you're saying, so when you say that you think that the therapist should take psychedelics with the patient, are you saying that that just enhances the experience, or would you say that that's required to have a healing effect?
No, I'm saying it's just it's a total different thing. And if you think about it, there is a certain voyeurism in, you know, it's the influence of psychiatry or medicine. Like if I give you an antidepressant, I don't have to take it. Right? Like
Right.
a doctor doesn't have to take the drugs that he prescribes for the patient. But I think that I made this point at least to get us thinking about psychedelics are not like psychiatric drugs. And in the legalization process, the legalization takes this whole adventure in the direction of treating LSD and other drugs as if they were psychiatric drugs. And I think that's a great mistake. And one of the ways I can emphasize it is that I personally wouldn't want to do a psychedelic session with someone who is not taking the psychedelic with me.
Okay, so you're just saying that it's kind of been filtered through the biomedical model, you know, and they put their own swing on how to use psychedelics. Okay, interesting. And then
if it's a sacrament, then the sacrament is taken by everyone. It's a participation. It's a togetherness.
Right, kind of like more like an ayahuasca ceremony then, or something like that. Okay, thank you.
Other questions? Just waiting for folks. All right. Does anyone have one there? Even if they can't figure out how to raise their hand? Okay, go ahead. Yep, there we go.
Okay. Well, thank you so much, Andrew. That was really fascinating. I especially enjoyed the part where you were talking about how the subjective feeling of connectedness diminishes the subjective feeling of pain. That's amazing. So question kind of following up on that, do you think that it's the sense Why do you think that is? And I ran across in San Francisco at an event at the library there, the term ontological shock. So this idea of kind of in that state, seeing things that cannot be unseen. You know, once you've gone through this experience, you have certain things that change you forever because you know what that, I don't know, that other, you know, you're integrating entropy from maybe the 0 point field or whatever. Do you think that it's along those lines that you know, people then know, okay, taking medication is just, it's not good for me?
You mean when the terminal cancer patients stop taking painkillers?
Exactly, that they know, or I'm curious to hear just your thoughts on that. Why they, why you see such a, you know, diminished amount taking medication afterward.
Look, I said earlier that Laing called himself empirical. That was the first word. And empiricism doesn't really make a distinction between correlation and causation. And
Okay.
causation is a very troublesome concept.
Mm-hmm.
And phenomenology is not interested in it at all. All I can say is that empirically, more and more, in more and more walks of life, it's a fact that people report. One example is women who give birth. There are countless reports of feeling excruciating pain. But when someone who the woman really loves, that could be a mother, or it shouldn't be. That could be a husband, or it shouldn't be. But someone who the woman really loves holds her hand, the subjective experience of pain diminishes. So somehow connection diminishes pain, and pain increases isolation. I don't know why, but it's definitely a fact. One of the first uses of LSD around the late 60s, here in Vancouver, there was a hospital, Hollywood Hospital, where they only did LSD therapy. And most of the people who were patients, there were about 9,000 documented trips in this hospital. Most of them were so-called alcoholics, people who have never been able to or never wanted to stop drinking, who preferred drinking to anything else. After, now in Hollywood Hospital, they gave 1,200 micrograms of LSD, which is a large dose. And they spent the whole day with the person. They had the highest level of recovery. People basically stopped drinking. Now, alcohol is a painkiller. People who medicate themselves with alcohol usually seems that alcohol makes life livable, because without it, just the sheer pain of feeling isolated, feeling ashamed, many other reasons, is just unbearable. After a psychedelic trip of 1,200 micrograms, it didn't make any sense. The pain of separateness disappeared. Shame disappears. You are a small part of something larger than yourself. Catholics have been talking about communion, and they talk about you being a cell in Christ's body. Now, when a cell is in its right place, where it belongs. When you realize you're a small part of something larger than yourself, and that's a realization, it's not just a cockamamie thought, then there is no pain. The cell doesn't feel pain. The whole body might feel the pain, or isolated cells, which are like cancer cells, they are in trouble. So I don't know the causation. It's simply every single session that I attended, both as recipient and as therapist, gave an example of how the connection relieved pain, suffering, tension. The greatest effect of all psychedelics is increased capacity for relaxation, which is what the Buddhists say. Like Buddhist psychology supports everything that you find out under LSD, and the LSD supports everything that Buddhist psychology says. The Buddha said, you are already a Buddha. So for self-realization, the path is relaxation, never effort. You relax into who you are, not work hard on changing yourself into something that's good. So that's a long answer to a short question.
Okay, perfect. So what I was asking was a bit too ontological versus your focus. Well, I definitely appreciate your expertise. So thank you so much.
Do we have another? Oh, I got another hands up. Ellen. Go ahead,
No,
Ellen.
I was just putting something in the chat. I don't have a question.
Okay. All right. Do we have some other? I want to give everybody a shot here. Trying to keep us just a few more minutes left. Okay, we got Andrew again. Go ahead.
Yeah, so I have a question. So for people interested in becoming a psychedelic assisted therapist, is there a training program that you would recommend? Because there's a lot of variety in the ones that I've looked at.
I don't know of any existing program that I would subscribe to. But I think it's about time to design a good one.
Mm-hmm. Okay, thank you.
All right. Other questions? Well, Andrew, do you, I mean, from what you've heard of the substance of like ayahuasca compared to LSD, do you see either of those being different? I guess the reason I ask that is because it seems like in LSD, you're largely dealing with a human world, whereas when you enter into something like ayahuasca, it sounds like it could be non-human world or more of a spiritual world. Or do you have any thoughts on that?
My experience is that whether some people make a differentiation between organic, like ayahuasca is organic, LSD is synthetic. I don't think it makes any difference personally. And I think the mythology, like even ayahuasca, depending on the culture that you happen to enter into when you take it, the imagery that comes when you get high, if you take it with, say, Santa Daime people, it's all Christian. Jesus Christ will appear to you. But if you take it with, say, a Peruvian shaman, the imagery will be totally different. And the experience will be different. I think what counts, what is transformative, whether it looks like whether the experience is more spiritual or psychological, it's still the experience which is transformative is that you are with other people in a very vulnerable state, and those other people don't hurt you. That's what's healing. The essence of trauma, the essence of the disaster that many of us went through, is that you were innocent, trusting, and someone hurt you. And from that moment on, it's difficult to trust anyone. From that moment, it's difficult to, what do you do after a disaster? How do you go on living when you were hurt by another human being? All these experiences are healing because you become vulnerable, and the person who is presiding could hurt you, and hopefully she or he won't. That's why it would be unbelievably harmful to, it would be unconscionable to take advantage of a patient under these circumstances, which unfortunately happens in, especially because you mentioned ayahuasca, some indigenous shamans don't have the, they never swore the Hippocratic oath. They don't think that the essential attitude is do no harm. So one has to be very careful who one chooses to become vulnerable with.
Thank you. I think we have one final question from Lee Yin.
Hi, I'm sorry, I'm on the road. My question is about integration and what your experience is with what happens after. Thank you.
Sure. Integration is, again, one of those meaningless words in my experience. I think it's very important to think of taking psychedelics within therapy. So I wouldn't just do a psychedelic trip with a stranger. I would first the relationship, then the psychedelic. So integration would be continuing the relationship after the experience. Like, how do you integrate climbing a mountain with your therapist? Well, continuing the therapy and continuing the relationship. There's a relationship before climbing the mountain. There is the climbing the mountain, and then you talk about how you know, I was in trouble and you helped me, or I was in trouble, you didn't help me, or I thought you were going to do this and you did that, and I had this experience. So this is where it's absolutely important that somebody who just wants to have a psychedelic experience without therapy is barking up the wrong tree. It's going to be harmful. So the integration is relationship. It's the relationship between the therapist and the patient that heals, not the method, not the protocol, not the psychedelic. It's the relationship.
Well, that sounds like a very perfect place to end for, and we want to thank you for a tremendously insightful hour here, and we appreciate it greatly. The students who are on the email, Andrew's email's CC'd in there, so you may be able to communicate with further questions. So we appreciate it greatly, and we will see you guys in the new year, January 21st. If you have some thoughts about another presentation you'd like, send them to me, and then I'll see if I can find a person hopefully as wonderful as Andrew to talk on that particular subject. So thank you very much.
Thank you. Bye.
Yes, thank you.